Kathy Kissinger. I'm 56 years old. I work in accounting, so I sit a lot during the day, and I've had a lot of back problems over the years. And I had heard on the radio about 30% of back pain is undiagnosed SI joint problems, and so there was a seminar that Dr. Kent was giving, and I went to it, and everything he said at the seminar was me.
My name is Dr. Roland Kent, and I am an owner and spine surgeon at Access Spine Center. I've been doing spine surgery for several years and concentrate primarily on complex reconstructive surgery and revision spine surgery. Patients that have had a lower lumbar spine fusion often will end up having pain and stress that is transferred to the sacroiliac joint. The second population in which I see sacroiliac joint pain commonly is in women that have had several children. The changes that happen during the delivery of a child can put extra stress on the sacroiliac joint. The diagnosis of SI joint pain can be somewhat complex. Once it has been correctly diagnosed through positive provocative procedures, then we can begin conservative treatment protocols, including physical therapy directed to the sacroiliac joint, continued injections if the patient has a good response to the injections. Chiropractic care has also been shown to be very effective in the treatment of sacroiliac joint pain. Unfortunately, there are some patients that do not respond to any of these conservative treatments. Several years ago, I became familiar with a minimally invasive approach for treating sacroiliac joint pain from the surgical perspective. I found iFuse by SI Bone. It involves a very small incision over the gluteal region in which we are able to spread the fibers of the gluteus maximus muscle and access the ilium. Through the ilium then, we are able to place devices across the sacroiliac joint that stabilize the sacroiliac joint. This is much preferable to more historical surgical solutions which involved large incisions, removing the cartilage from the sacroiliac joint, and then packing the joint full of bone graft and hoping that it would fuse on its own. Stabilizing the SI joint with the iFuse device has provided very good outcomes in patients that previously would not have had any good surgical options for the treatment of their back pain.
I had flowers, I couldn't garden, I couldn't do anything. I did nothing, I had no life, so it was very bad. I knew the minute I woke up from surgery that it was a success. I mean, I have a life now. I can walk, I can sit, I can play with my 6-month-old grandson and pick him up and carry him, and I wouldn't have been able to do that before. If you have SI joint problems and you get the fusion, it changes your life.